caused by ruptured capillaries. What are the skin's tiny red spots called? A. Leukopenia. B. Pimples. C. Petechiae. D. Papilledema. The correct answer is C. Petechiae. Choose the term that means accumulation of fluid in the tissues. A. Trauma. B. Cannulation. C. Edema. D. Hematoma. The correct answer is C. Edema. Where is the pulmonic valve located? A. Between the right atrium and the right ventricle. B. Between the right ventricle and the pulmonary artery. C. Between the upper and lower chambers of the heart. D. None of the above. The correct answer is B. Between the right ventricle and the pulmonary artery. Your only choice is to draw a specimen from a site with a hematoma. Where should you get the specimen? A. In the area or region of the hematoma. B. Proximal to the hematoma. C. Distal to the hematoma. D. None of the above. The correct answer is C. Distal to the hematoma. The blood collection site has been bleeding for more than 5 minutes. What should you do now? A. Apply a pressure bandage over the site. B. Notify the patient's physician or nurse. C. Bandage the site. D. None of the above. The correct answer is A. Apply a pressure bandage over the site. There are a number of phases within the mechanism of hemostasis. Which of the following describes phase 1? A. Fibrinolysis. B. Coagulation stage. C. Platelet phase. D. Vascular stage. The correct answer is D. Vascular stage. Choose the best definition of hemostasis. A. Blood flow stoppage. B. Steady state. C. Food stoppage. D. Basal state. The correct answer is A. Blood flow stoppage. Choose the word that means the breaking down and removal of a clot in hemostasis. A. Coagulation. B. Fibrinolysis. C. Vascular. D. Aggregation. The correct answer is B. Fibrinolysis. When choosing tubes for capillary specimens, what type of tubes do you draw first? A. Those with heparin. B. The SST version. C. Tubes without additives. D. Tubes with additives. The correct answer is D. Tubes with additives. What can occur if the tourniquet is left on longer than the generally accepted minute at a time? A. Thrombosis. B. Hemoconcentration. C. Hemolysis. D. Septicemia. The correct answer is B. Hemoconcentration. Identify what is considered a post-analytical error in the laboratory testing process. A. Improper use of serum separator. B. Improper site preparation. C. A failure to invert tubes. D. A delay in reporting results. The correct answer is D. A delay in reporting results. Which of the following during the process of vein selection is bad for the specimen? A. Using a warm towel to increase the patient's blood flow. B. Allowing the patient to pump their fist. C. Palpating the antecubital region. D. Lowering the arm of the patient. The correct answer is B. Allowing the patient to pump their fist. What does postprandial mean? A. After eating. B. After sleeping. C. After a blood test. D. After 12 a.m. midnight. The correct answer is A. After eating. When collecting multiple blood specimens, the blood should be drawn in the correct order to minimize contamination or clotting. The recommended order is A. Blood cultures, sterile tubes, coagulation tubes, serum tubes, heparin tubes, EDTA tubes, glycolytic inhibitor tubes. B. Tubes without anticoagulants, blood cultures, coagulation tubes. C. Coagulation tubes, anticoagulated tubes, blood culture tubes. D. None of the above. The correct answer is A. Blood cultures, sterile tubes, coagulation tubes, serum tubes, heparin tubes, EDTA tubes, glycolytic inhibitor tubes. You arrive to draw a fasting specimen just as the patient finishes breakfast. What should you do? A. Go ahead and draw the specimen. Breakfast was likely not yet absorbed. B. Draw the sample as planned, but write the word non-fasting on the lab request. C. Ask the patient to ring up the nurse to learn what to do. D. Seek out and ask the patient's nurse to learn whether you should still collect the sample. The correct answer is D. Seek out and ask the patient's nurse to learn whether you should still collect the sample. Which of the following is the most important step when performing a routine venipuncture? A. Identify the patient. B. Tie the tourniquet. C. Gather the equipment. D. Palpate veins. The correct answer is A. Identify the patient. How many hours prior to having a fasting blood test should an individual refrain from eating? A. 10. B. 8 to 12. C. 6. D. 4. The correct answer is B. 8 to 12. Factors ensuring proper outcomes of laboratory results during collection and transportation include all of the following except A. The use of recommended laboratory collection tubes. B. Interpretation of requisition. C. Patient sample matching, for example, labeling. D. Asking the patient to assume a standing position. The correct answer is D. Asking the patient to assume a standing position. Procedures for filling the laboratory sample tubes include all of the following except A. With multiple tubes, use evacuated tubes with a needle and tube holder. If not available, use a syringe or winged needle set. When using a syringe or winged needle set, place the tube into the rack prior to filling the tube. Using one hand, fill the tube, or use a needle shield between the needle and hand while holding the tube. B. Keep the tubes in a rack when possible. C. Use a mop to wipe up liquid from spills of blood or other bodily fluids. D. Remove the tourniquet as soon as you establish blood flow, and always before the tourniquet has been in place for 1 to 2 minutes or more. The correct answer is C. Use a mop to wipe up liquid from spills of blood or other bodily fluids. Closed and open needle system types used in blood drawing include all of the following except A. Vacuum extraction tube systems. B. Double-ended needles. C. Winged butterfly needles and lancets. D. Auto-disable syringes. The correct answer is D. Auto-disable syringes.